Piles is one of the preventable and treatable condition, and one of the easy way to prevent or treat piles is the right diet. The main goal of the right diet is to increase the bulk of the stool so that you strain less during bowel movement. People suffering from piles should include or should try to have more fibers or fiber rich food in their diet. Why? Because increasing the proportion of fibers will help to increase the bulk of stool. It will help in softening your stool, which will ultimately lead to an easy passage of stool and thereby reducing the straining. Before beginning with this video, I would like to make one thing very clear, that the dietary changes is applicable only for the early piles, that is grade 1 and grade 2 hemorrhoids only. Now coming to the dietary changes. Number 1 dietary change will be to include green leafy vegetables in your diet, such as palak, methi, cauliflower, cabbage, broccoli, ladyfinger. These foods are very rich in fiber. Second dietary change will be to include whole grain such as gehu, that is wheats, millets, bajra, oats. Third dietary change will be fresh fruits. Now, when we come to the fresh foods, you should make sure that you should also include the skin, such as the apple. You should take the apple along with the skin, because ultimately skin is the one which is very rich in fiber. Other examples of fresh fruits are papaya, banana, grapes, guava. The fourth dietary change will be sprouts. But one thing you should keep in mind regarding sprouts is that you should take either steamed or boiled sprouts only. Raw sprout is not good for your gut. The fifth dietary change will be to include probiotic rich foods such as curd or buttermilk in your diet. How does they help? Well, this probiotic rich foods helps in improving your gut flora, which thereby helps in improving digestion and immunity. The last but not the least dietary change will be to have ample amount of water, that is around 3 to 4 liters per day. If you don't increase your water intake, the previously mentioned dietary changes won't work so effectively. Why? Because fibers need water. The fibers absorb water, which helps in softening your stool. So, make sure to have at least 3 or 4 liters per day. But if you are a kidney patient, if you are having any renal disease or liver disease, then you should consult your doctor before increasing your water intake.